Hello everyone, in today's video I'm gonna show you how to set up the operating room for anesthesia in 2 minutes. Let's review what a complete operating room anesthesia setup entails using the well-known MSMAIDS mnemonic. MSMAIDS stands for machine, suction, monitors, airway, IV, drugs, and special. Start the anesthesia machine monitor and computer, run the self-test, adjust the machine parameters depending on your case and patient's information. Check the volatile agent levels. The most important self-test is the low circuit pressure test. To do this, you need to occlude the Y-piece, close the pop-off valve, flush O2 and ensure that there is no pressure leak up to 40 cm hydrargyl. Make sure there is an ambu bag in the room. Make sure the suction circuit is connected and suction tip is available. Suction is super important and must be always prepared in order to prevent aspiration during induction prior to general anesthesia. Patient monitoring is extremely helpful and important for anesthesia monitoring. Monitor must be checked and prepared depending on the nature and duration of the case. Outside of the machines, internal monitors, O2 analyzer, etc., you need a plethora of internal monitoring devices. Laryngoscope of your choice must be prepared before any type of anesthesia. I'm always preparing 2-size laryngoscopes. You have to make sure the light is functional. Prepare efficient endotracheal tubes. Stylet must be placed and cuff checked for a leak. Oral airways I'm preparing in 2 size. Make sure a laryngeal mask, airways, bougies and glide scope are readily available in the event of a difficult airway. IV access, you can usually do this after the room is set up. Most of my adult patients start with a 18 gauge peripheral IV for anesthesia induction. If I need more lines, I put them in after they are asleep. This is also when I decide whether the patient needs a pre-induction arterial line or central line with high flow for massive transfusion. Induction and emergency drugs must be prepared for any type of anesthesia. Usually I'm preparing drugs for premedication, induction and emergency cases. Special is the obligatory catch-all category. This is for everything else, like OG and G tubes, urinary catheter, warmer blanket, fluid warmer, specialty tubes maybe for laser or maxillofacial surgeries, ultrasound for transesophageal or regional anesthesia. Now here are 2 images comparing my setup and our messy anesthetist setup. Notice the similarities and differences down below. Thanks for your attention.